Correct, so this is my video of hip examinations. I'm going to start off by talking about doing the inspection, looking at the gait, and then checking for palpation, range of movements, and the special tests. Okay, so I'm Dr. Sase. I'm one of the doctor. I'm just going to be examining your hip today. Is that be okay with you?
Yes.
That's fantastic. Okay, so I'm going to start by looking at your hip. So if you could just lift up the shorts. That's okay. So what I would like to do is I'm just going to have a look from the front and looking out for any obvious pelvic tilt, any wasting of the quadriceps, any scarring or skin changes, and if there's any leg discrepancy. So if you could just turn to your left side now, and I'm particularly interested in lumbar lordosis because that may suggest a fixed flexion deformity of the hip. Okay, if you could just turn to your back now, and I'm just looking at any wasting of the hamstrings, seeing if there's any, so I'm just looking at your back, I'm seeing if there's any pelvic tilt or any scoliosis. That's great. Okay, so I'm going to start by making you walk. So I'm just going to check in. So if you just walk toward that way, that's great. And then come back. I'm looking to see if there's an antalgic gait, Trendelenburg's gait, suggesting an abductor weakness of the affected hip. If it's bilateral, it could be what with a waddling gait. So next phase is looking at what with Trendelenburg test. So what I'd like you to do is I'd like to just put your hands just above my shoulder there, and I'm just going to have a feel just over the brim of your pelvis. And if you could just stand on your just right leg for me, and just keep it still. And if there's any tilt, so for example, if there's any drop of the contralateral side of the pelvis, it may suggest the weakness of the affected hip, standing hip. Okay, that's fantastic. Can you do the same on the other side? That's great. Okay, so there's no pelvic tilt there. Okay, that's great. And now the next one is they're looking at sacroiliac joint dysfunction. So if I could just ask you to just stand on the one leg again. Okay, and if you just tilt backward as far as you can. Is there any pain there?
No.
No? Okay, that's fine. If there's any pain around the sacroilium, it may suggest the sacroiliac joint dysfunction. And if there's any pain at the more above, it may suggest spondylolysis. That's great, thank you very much. So the next phase is looking at the your hip again. So if you could just lie on your back again. That's great. So we're going to be checking for leg discrepancy. So I'm going to start by doing checking for true leg length. So that's, and I'm going to pretend as if I got a tape measure. I don't have it with me today. So feeling for anterior spherical spine, and then feeling for the median malleolus. And you do the same thing on the other side, and always compare the both sides. If there's any discrepancy, it may suggest fixed flexion deformity or actual shortening of either femur or tibia. And the next one is looking at apparent leg length. So if you just lift up, if you don't mind just lifting up the shirt a little bit, that's great. And I'm going to be checking from the umbilicus, the median malleolus, and the other side. And if there's any discrepancy, it may suggest fixed flexion deformity of the hip or any other hip pathologies. Okay, that's great. I'll just lift up again. Alright, so the next phase is the palpation. Palpation is looking systemically from the front to the side to the back. So I'm going to start by feeling for now the anterior superior iliac spine, feeling for the greater trochanter. If it's tender there, it may suggest trochanteric bursitis. And also around the groin areas, this is the anterior hip, to see if there's any hip pain. And also I may just feel for pubis, for any pubic osteitis. Right, so if you don't mind just turning around, and I'm just going to have a feel of your back. If there's any pain, let me know. So I might just feel, at this point, I might feel for sacroiliac joint, so just sacroiliac joint dysfunction. And also, I might just feel around the ischiotuberosity to see if there's any chronic hamstring tendinopathy, and slightly lateral to that to look, and if there's any tenderness there, if the pain goes down to the legs, it may suggest a piriformis syndrome. That's great, thank you. So if you could now turn around again. Next phase is looking at range of motions. So I'm going to start off by moving your hip again, okay? So first of all, looking at the hip flexion. So just bring your hips up, down, like that. 120 degrees is normal, and this is probably about 120 degrees. The same on the other side. Always compare to both sides. Again, the flexions there. Guess the next one is adduction and abduction, and I always feel for the pelvis to see, make sure it's not tilting, and I'm going to abduct the hip to the side way. Normally it's about 30 degrees, and now it's adduction of the hip, and that's a good range of movements there. Now abduction and adduction. That's fantastic. Next is looking at internal and external rotation. I'm going to move your hip again, 90 degrees at hip flexion, and this is internal rotations. And now that's external rotation. If there's any pain at end range of movements, you may be looking at things like osteoarthritis, or it could be things like a stress fracture of the hip. Same on the other side. External rotations and internal rotations. That's great. Okay, so if you could just turn around now, and we're now looking at extension of the hip. Extension of the hip normally is around 20 degrees. So I'm just going to move. I'm just going to lift up your hip a little bit. Let me know if I'm hurting you. That's probably just more than 20 degrees there. Same on the other side. That's great. Okay, fantastic. So if you could just now turn around. Now next test is what we called Thomas test. And Thomas test essentially looks at to see if there's any fixed flexion deformity of the hip. And that may well be common in patients with for example, chronic osteoarthritis of the hip. So what we do is, if you could just bend your hip as far as you can on both sides, that's great, and just hold it there for me. And I'll just put the hands just behind the lumbar area to make sure that there's no compensation of the lumbar flexion. Okay, so what I'd like you to do is I would like you to now hold this legs in place, and the other leg to straighten your legs, and just down to the all the way down to the floor, to the sofa. And if the legs can't reach the bed, then it may suggest that there might be a fixed flexion deformity. Okay, what I'd like you to just do the same thing on both sides now. Okay, and just hold this leg and just straighten this leg. Okay, so then this leg reaches the bed as well. So that there's no flexion deformity there. Okay, that's fantastic. Thank you. The next phase is now looking at more the special tests. So we start off doing Faber's test. Faber's test involves flexing the hip, externally rotating the and abducting the hip, and like so. And I'm going to hold the contralateral hip pelvis in place just to stabilize it, and I'm going to push down. If there's any pain or anything like that, it may suggest some hip pathology. Alternatively, it may suggest sacroiliac joint dysfunction if there's pain at the back. Okay, that's great. So that's Faber's test. I'll normally do the same thing on the other side. And also the next test is what we call the Faber's test. And this one involves flexing the hips, abducting the hip, and internally rotating. And you really push it. If there's any pain, especially at the back, it might be piriformis syndrome, Alternatively, it may be suggestive of anterior acetofemoral impingement, femoral acetabular impingement. Okay. Okay, so the next test we're going to be looking at what we Ober's test. So if you could just turn toward the wall for me. And what we're looking at is looking at the tightness of the iliotibial band and the pain around the area. So how we normally do it, we feel around, just around the greater trochanter. And I'm going to extend the hip slightly and lift it up. You can move up and down a little bit. This is a clunk or a painful click, which might suggest the pathology. The other thing you could do is, this is called Ober's test, so you could just keep the hip abducted in this position and you could release the legs. And what we see in the positive Ober's test, the knees are not able to meet the other, don't go as far as going down meeting the other knee. And this may be suggestive of a tight iliotibial band. Okay, thank you very much. So that's looking at Ober test. And finally, I would like to finish off by looking at neurovascular status of the hip. So what I'm going to do is I'm just going to see how warm your foots are. Okay, and I'm just going to feel for the pulse, for the dorsal pedis. You've got a good dorsal pedis there. And now the posterior tibial artery. And again, it's nice, good pulsations there. I'm just going to check your sensation. Let me know if you could feel me touching you. Feel me touching you there?
Yes.
There?
Yeah.
Does it feel the same
Yeah.
on both sides?
Yeah.
Are you able to wiggle your toes? That's great. Fantastic. So, this is the end of the hip examination. Thank you very much. Thank you.
Thank you.